to educate people, to inform people, to let people know that this is the plan that we have on ground to tackle hepatitis, to nip it in the bud, because hepatitis globally kills people. Millions, like, let's say the statistics has it at 304 million people worldwide have hepatitis A, B, and C, and the deadly ones B and C. They go down with it, and this liver disease spirals from hepatitis to other diseases that we are going to know about in the course of this health program. So first, we're going to talk about the campaign focus and goals of World Hepatitis Day. The focus is to remove barriers, addressing high cost of treating hepatitis, the high cost of treating hepatitis, talking about social stigma. We know in our climate, in our society, if one gets to know that you are suffering from a particular disease or illness, that's how you'll be absconded. They'll try to isolate you from the circle and push you with that stigma, okay, a certain, you'll be looked at in a certain way. So the essence of having this discussion is to remove that barrier of social stigma and to promote care and access. That's the essence of this. Another campaign focus is actionable science, turning effective vaccines and curative treatments into widespread practice. Not us just hearing that there are vaccines that would be taken for hepatitis prevention, but us having access to it, us having a hands on it, and not to hear and to hear alone. Another focus and goal of the campaign is political commitment, mobilizing global leaders. Like I said earlier, this is not just a family thing. If a person in a particular family goes down with it, they say, that's your family problem. No. You know why? Because hepatitis is contagious. It is contagious. So if you say it's not my business, it will be your business. If it's not going to affect you, it might affect somebody that you know, your family member, your friend, your colleague. So it's not about the person that has this disease alone. It's about the community. It's about the state. It's about the nation standing together to do all they can to fight hepatitis, mobilizing global leaders to invest in diagnostics and primary health care. What are the duties of the government? Oh God. I don't want to stay here to say I am praising the government of Akwa Ibom State, but if you are a keen listener of Planet Radio, in our news bulletins, in every of our programs, I could say, maybe not sports, we give you updates on what's going on in every sector in Akwa Ibom as it happens. So I will point it out that the government of Akwa Ibom State is doing his best in making sure that our health care system in Akwa Ibom have the necessary equipment and instruments needed, required to take care of its citizens. Like I said earlier, it's not. I just want to admit it. I just want to accept it. I just want to let you know, because I'm in the media. I follow the news. I know what's going on. Okay, it's not just a hearsay. So these are the campaign focus and goals for political leaders to get mobilized, to invest money, to put in effort, to recruit medical personnel into the primary, secondary, and tertiary healthcare systems in Nigeria. What this person? Okay, I didn't even open up. Hello, good morning.
Morning.
Yeah. Welcome to Planet Radio.
Planet Radio.
Yes.
Okay, my name is Elder Abamete from
Elder Abamete, good to have you.
Thank you. So enjoy your life.
Oh yeah, it's really enjoyable. Say so, come out. No, Messi thank you kang yan do yine kwaibom. So kebi Dyson giko sen yan infin hepatitis demystified types, test and treatment Abamete.
Treatment. Hello, my sister.
Yes, please.
Mama
okay, so thank you. It's Abamete. Okay.
God bless you, my beautiful sister.
God bless you. God bless you too. Thanks so much for reaching out, Abamete. I was still talking about the campaign focus and goals, just to realign the conversation we will be having today with the World Hepatitis Day theme, hepatitis. Let's break it down. But today we are handling, like I told you earlier, we're talking about hepatitis demystified, test, types, and treatment. I have not opened up the phone lines officially. Oh my God, calls are coming in, but please. Please, I will have to let Dr. Afia say something first. Okay. Hello, good morning. All right. I have to let Dr. Afia really delve into the topic that we're handling this morning. Let's talk about it because, oh my God, we're almost halfway into the time. Doctor, good morning. Good to have you. Yeah, it's always a pleasure. I'm having Dr. Afia Itur, a medical practitioner right here. He's a family physician and a medical director. Like I told you earlier, I will not be doing this alone. Doctor, good morning.
Yeah, good morning. I'm sorry I'm late. The road was quite impassable. Yeah, I had to swim to get here, because aspects of the road was taken over by water, the river overflew and all that. So, yeah, I had to cross 7 seas to get here. That's why I'm late.
The government of Akwa Ibom State.
No, it's not a government.
No. I hope they are remembering. Doctor, I know we're talking about health, but people really are concerned that they should talk about this earlier enough, okay? So you were hampered because of how the road is. Who are we supposed to call them?
No, that's not.
If that road, if our road is tarred,
the government is working on your road.
Yeah, I'm just calling on the government.
It's deranged.
I just said, government, please speed it up.
Government is doing.
Government, thank you. We see what you're doing, but we're saying please speed it up. Doctor, thank you once again, and we're sorry about that, but it's beyond our control. So let's talk about hepatitis.
No, the river flooded the road.
That's why I said it's beyond our control.
Yeah, actually. Now, hepatitis is simply inflammation of the liver. Inflammation of the liver. That's hepatitis. That's what it means. Your liver is like your body's chemical factory. The liver helps us to detoxify toxins, helps us to store energy, also helps us to make proteins as well as clotting factors, the things that make our blood clot. So when it is inflamed, it doesn't do well. Okay, so hepatitis, inflammation of the liver, has actually, a lot of people have this misunderstanding about it, or have lack of knowledge about it. And as a result of that, we actually have barriers to testing and treatment. But the goal by WHO is to try to attempt to eliminate hepatitis, against 2030, AGOG 2030. So that's the goal. So we have to be able to stop the stigmatization by creating awareness on how this disease is transmitted and also prevention. All right, so the WHO has identified 4 pillars that will help the actualization of this, goal, eradication of hepatitis. Talk about equitable access, like everyone should have access to, hepatitis treatment, testing, screenings. And then the WHO wants the barriers to be removed, thereby reducing stigma. Right, so the WHO also wants health integration, where just like we have compulsory mandatory testing for HIV during antenatal services and other screenings, they want it to be incorporated into healthcare, especially at most of these things are achievable, especially at the primary healthcare level and all that. And then the WHO also wants, actions and innovations to come in full swing that will help accelerate the research training, and that would help create a driving force to help actualize this goal for 2030.
Okay. Doctor, you mentioned that hepatitis is an inflammation of the liver.
Yes.
And one's liver is a vital internal part of every human being. And when there's an inflammation, that's a problem.
That's a problem.
Okay.
So you say sweetheart, I say sweet liver.
Oh.
Because yes, your liver should be sweet enough.
Okay, I think doctor just said something. All right, sweetheart. Sweet liver.
Yeah, learn to say sweet liver.
Oh. Okay. So, doctor, what causes the liver to have an inflammation?
Yeah, there are 90% of the cause of inflammation is viral hepatitis. Viral. We have viral hepatitis. We also have bacterial causes. We have fungal causes. That's not to say that there are non-infective causes.
Okay. That's why we want to talk about that right away.
So we have the infectious causes and the non-infectious causes. For the infectious causes, we have mostly by the viral hepatitis, bacterial, fungal causes. And then for the non-infectious causes, we have your alcohol, we have the drugs of abuse. Also, there's a drug that we take, and then some people tend to abuse it. Then paracetamol toxicity can affect the liver. All right, so paracetamol in high doses could be toxic to the liver. Other toxins, and then it could also be metabolic causes like diabetes. Immune conditions can also affect the liver. The environment, heavy metals in the environment could also, affect the liver, thereby causing hepatitis.
Those are the causes.
Yeah, so for the viral causes, we have 5 main types. We have hepatitis A.
Sorry, doctor.
Yes, the hepatitis A is spread via fecal-oral contamination of food, water, and also when there's poor hygiene. Okay, we have the hepatitis B, which is via blood or sex, sexual intercourse, or via mother-to-child transmission. It can also be transmitted via needles, sharp razor, and even tattooing. During the process of tattooing, we can have the hepatitis B transmitted. Hepatitis C can also be transmitted via blood, needles, on-screen blood transfusions, unsafe medical procedures can, cause hepatitis B to be transmitted. Hepatitis C is mostly chronic, about 70 to 80% of hepatitis C, whereas the hepatitis B could be acute or chronic. Hepatitis B and C have some form of chronicity, and those are the ones that lead to, liver cirrhosis, liver cancer, and whatnot. The hepatitis A, like I mentioned earlier, is actually self-limiting and not chronic in itself.
Okay, acute.
Yeah, so the major route for the hepatitis A, like I already said, is the fecal-oral route. I've talked about the hepatitis B and C. Now we talk about hepatitis D. Now, hepatitis D is quite funny. Hepatitis D only occurs, concomitantly in individuals who've had hepatitis B. So hepatitis D will require hepatitis B to occur, or we call that supra-infection, or it occurs concomitantly. All right, so then we have hepatitis E, which is also transmitted via fecal-oral routes, contaminated water, and also undercooked food, for instance, your pork and all that. It can affect pregnant women and immunocompromised individual, talking about the hepatitis E. Still on the causes, we have the non-viral causes, which I already talked about. Alcohol, where we have alcoholic hepatitis, and this can result in scarring. Chronic alcohol use and abuse can result in scarring of the liver, thereby leading to liver cirrhosis and can proceed to onward liver cancer and whatnot. Drugs and toxins I already mentioned. Paracetamol overdose is the number one cause of acute liver failure.
Is it, doctor? Let me just cut you right there, please. You kept on mentioning paracetamol. I know that's like a general tablet or medication. I would say that a lot of people know. Is that the only medication that, if taken overdose, it could cause? Are there other?
No, there are other drugs like all these cleansers the people take, these herbal potions and herbal concoctions,
okay.
And even some TB drugs can affect, can cause what we call hepatotoxicity.
Okay.
All right, so mostly taken for pains and whatnot is the paracetamol, and most people may tend to abuse paracetamol, and that alongside other herbal concoctions can cause hepatitis, and thus lead to liver failure, acute liver failure, and so on. Sometimes the body attacks the liver cells. The body in itself, on its own, attacks liver cells, and that we call the autoimmune. It's an autoimmune condition.
Yeah.
Then we could have fatty liver. People who are obese or have diabetes can have, these problems. Obesity, diabetes can lead to fatty liver, and that can affect the liver. We also have metabolic diseases like Wilson's disease that can affect the liver. These are some, non-viral or non-infectious causes of, liver inflammation that I have just talked about.
Okay. Doctor, we know that hepatitis can be sneaky, and sometimes the signs and symptoms will be noticeable. Sometimes you cannot place your hands on it. So let me ask, what are the general, signs and symptoms, being that we have strains of hepatitis like the A, B, C, D, E? What are the general signs and symptoms of hepatitis?
Let me break it down to stuff you will see or signs or symptoms you will see in acute hepatitis.
Okay.
And then chronic hepatitis. We
All right.
have the acute one, we have the flu-like, most like you're having a flu, like fever, fatigue, nausea and vomiting. You could find that as symptoms for people who have just, who are just acutely ill. And then they could be jaundiced. Yellow eyes, yellow skin, dark urine, pale stools, right upper abdominal pain, as well as itching. So some people would naturally just go and start treating malaria because
Okay.
it mimics malaria. And that's not to say that malaria, sometimes malaria can cause what we call hepatomegaly. It can be inflammation of the liver or from severe malaria.
Okay.
So
it could also make someone's eyes to be yellowish, like that jaundice.
yeah,
you
severe
just
malaria
mentioned.
can cause jaundice.
Okay.
Severe malaria could cause jaundice. When we talk about malaria,
Yeah.
we talk about that pathophysiology. But most times people miss it and they go treating other things other than, they start taking medicines from over the counter and meeting people who are not
Without appropriate
tests,
diagnosis.
test screenings and diagnosis. So for the chronic hepatitis, it might just be there silent for years. Someone can carry it for years, just silent carrier, and boom, later in life.
So, doctor, hepatitis B and C are under chronic.
They can have the tendency to be chronic. Although hepatitis C can be cured,
Yeah, okay.
treatment ranging between 8 to 12 weeks can be cured. Whereas the hepatitis B, we have, it may be cured, but it hasn't reached this part of the country or part of the world. But there are intensified efforts by companies like GSK and all that are helping to formulate drugs, and they have carried out random clinical trials to see how effective the medicines that they have made, to see how to treat or manage hepatitis B.
Okay. You're
Especially.
talking about the signs and symptoms for chronic hepatitis.
Okay, so we have fatigue, weight loss for those ones that have become chronic. They've carried it for a long time, and they now start later, having been asymptomatic for a while, may present with weight loss, may present with swelling of the legs and abdomen, confusion, bleeding, start having confusion, start having bleeding. Some people that present with swollen abdomen and swollen legs may be confused for people that say, how do they call it in our local parlance? The thing that makes people's legs swell. Say or something like that.
Okay. Is it bonocode?
Yes, stuff like that. And then big belly and all that. So
Okay.
they come down that way from the chronic hepatitis, but it's very classical if you are clinically vast in stuff like that.
All right.
Yeah.
So those are the signs and symptoms of hepatitis.
Yeah.
Doctor, hepatitis can spread from one person to another. It can be viral. How does this happen? How does one that has a liver inflammation as a symptom of hepatitis, as one that has hepatitis, how does it pass from that particular person to another person and it spreads from there?
I've already talked about food when I mentioned the 5 different types. I talked about food, fecal-oral transmissions, hand to mouth. When you don't wash your hands properly, you could pick these things up from, food. People living in dormitories, are very likely to come down with those kind of hepatitis. So you have the fecal-oral transmission. It could be born in water, improperly cooked food. That's generally speaking now. It could also be through sexual, contact, or it could also be through blood transfusion, unsafe blood transfusions. You could have where you have sharing of needles, sharing of sharp objects. For those of us who go to the barber shop without our own equipment, or for those of us who do pedicure along the roadside, I mean, how safe is that stuff? Doing pedicure and manicure by the roadside with sharp objects. Those are, you shouldn't be sharing sharps. So, but people, intravenous drug users, people using the same equipment for manicure, pedicure, mother-to-child transmission can occur. Yeah, so those are the routes, those are the ways that it can be transmitted.
All right. This is Health Ways once again, and if you're just tuning in, I am reminding you that you're listening to a health program called Health Ways on Planet Radio 101.1 FM. My name is Ofonono Joseph. We're discussing hepatitis demystified, test, types, and treatment. Test, types, and treatment of hepatitis. You've heard the word. If you've never known what it means, the doctor has just said it. I have Dr. Afia Itoro in the studio. So now I'm opening up the phone lines. I've been seeing calls coming and I didn't even really break it down. So now you can call in to talk to Doctor while the conversation still continues in the live studio. 0806 804 5443 0806 804 5443, or you send a WhatsApp message or traditional message to 0902 223 1011 0902 223 1011. That one is for WhatsApp messages only, while you can call directly 0806 804 5443. Doctor, back to you. There are times that we talk about certain diseases or illnesses and we will say it's maybe it's that kind of sickness is basically for elderly people or something. Does hepatitis have any age factor?
It cuts across all age groups. Across all age groups. I've talked about the blood transfusion. I've talked about their age groups that take blood. There are age groups, the mother-to-child transmission. Then, of course, there are people that probably have hepatitis and it remains silent for years. All right, so it cuts across all age groups.
So it's not for the elderly, it's not for the young, it's
cuts across all age groups. Women, pregnant women, breastfeeding. There are some myths, though, which if we have time, I can demystify, concerning the hepatitis. Some people feel that if someone is jaundice or has yellow coloring, that they may have hepatitis, or you shouldn't touch them and all that. So there are myths. If we have time, we could. You are trying to find out if it affects all age groups. I say yes, it does.
Okay.
Yeah.
Doctor, quickly, what happens to a person that has the symptoms you earlier listed, and unfortunately it is hepatitis, but the person has not gone for a test, or at some point the person goes for a test and the result of the diagnosis is that the person has hepatitis, maybe B, C, D, and the person tries to just get medications, just treat it casually, but the disease is still there, the viral disease is still there. What happens to one that has hepatitis and it's left untreated? proper treatment, what does it spiral to? What does it generate to?
Do you want to die? How could one have such a disease and not want to get treated or not want to? Do you want to say that it's a spiritual problem? Like we always say.
Someone could always say, I don't have money, or, this thing will go, or I'm an African person. It will not survive in my body. It's, what happens so that people are well informed that
let's have major public health, awareness. It's hepatitis is especially the viral hepatitis, is a major public health concern. If you don't want to come down with it, there are vaccinations, okay, for certain age groups. So we want to encourage timely, vaccination. And they may not be cured yet for some of the hepatitis, and then some of them are rate limiting or self-limiting, like the hepatitis A. So maybe someone got lucky and had the hepatitis A and said, oh, I went and I tested and I got hepatitis A. It's self-limiting. It's not chronic. But for the hepatitis B and C, they have some form of, they have chronicity, okay? They're chronic and can lead to liver issues. So if you test and you see screening, you should be able to do screenings, all right? Regular screenings, and then you find out that there's hepatitis, you should present to the hospital instead of waiting to find out what could happen if you do not present. It could be too late. This, especially hepatitis B, is a very, very virulent, kind of hepatitis. So you don't want to sit back there at home and self-medicate. You could get worse. So early detection and prevention is key to having not coming down with these virulent viruses.
Okay.
Or virulent hepatitis.
All right. So we hear things like cancer of the liver. There's something like that. Can it generate from?
Progresses from liver cirrhosis, injury to the liver, progresses to liver cirrhosis, and then liver cancer.
And when it gets to points like that, is there hope for the person?
My hope is in Jesus Christ.
Doctor.
My hope is in Christ alone.
Doctor, you're a medical professional.
I don't want to sound like a prophet of doom, but there are certain things you don't come back from. Like the organ that's responsible for detoxifying your body, doing a whole lot of things that I mentioned, gone from your body. There's no coming back from that. Maybe there's liver transplants and all that, but how many people could afford, liver transplants and all that? Prevention is key. Prevention is cheaper. Prevention is the best form of health care.
All right.
A lot of people are always too careless, about their health, such that they just want to see what happens. They just want to find out what happens and then start, going from pillar to post. And most times they don't go to the right places. They just worsen their health by going to the wrong places and then self-medicating and taking potions that further injure them. So a lot of awareness has to be created.
And one doesn't have to wait till it progresses, damages one's.
Of course, it's common sense. It's common sense. Well, that's why we talked about the barriers. So I believe the government is doing a lot. I must commend the Ministry of Health and its commissioner.
That is leading me to my next question.
Yes.
What are the necessary tests that one should undergo or have if to be sure that I have hepatitis? Okay, what's the treatment? Before the treatment, what are the necessary tests? And do we have the equipment, the necessary equipment?
We do screenings for you to know that there's, first of all, prevention. Let's talk about prevention of mother-to-child transmission, where during the regular, we have universal antenatal screenings against HIV, against syphilis, against hepatitis B. Those reagents are there. They're there for screening. And then adult vaccinations for certain age groups are there. And there are drugs for hepatitis B, like the tenofovir fumarate, the entecavir, most of all those combination drugs. Some of the drugs that are used for the treatment of HIV are also used for the treatment of hepatitis B. Okay, so we want to nip this virus in the bud because it has the viral replication stage, the prodromal stage, and all that. So we want to, most of these, like the hepatitis C, I said, is curable. All right, so there are treatments for it. But if you don't know whether you have the hepatitis or not, you wouldn't know how to get treated. So the investigations or how it is diagnosed is important. Okay, so your doctor would want to do some blood tests where they check the liver enzymes, and the doctor will be looking out for bilirubin. Bilirubin will also be looking out for ALT or AST, those liver enzymes. They will also be looking for viral markers like hepatitis A surface, hepatitis B surface antigen. When you are trying to screen the individual for hepatitis B, we're looking for anti-HCV. When you are screening for hepatitis C, we're looking for IgM. We're looking for anti-HAV. When you're looking for hepatitis A, and so on and so forth. So we also want to look at the HBV DNA when we're looking for the viral load to see how active especially for the hepatitis C virus, how active the RNA is. The RNA is, okay. Then we'll also want to do a scan, ultrasound scan, to see check for scarring, where there could be liver cirrhosis. So we call that ultrasound or a fibroscan. And of course, rarely we do liver biopsy. The treatment, like I said, depending on what kind of hepatitis, but most times prevention is key, and then also vaccination. Well, treatment will come based on prevention and then active and actual treatment. So we want to, vaccinate. We also want to, do regular screenings to see, to help rule out if someone is carrying the hepatitis. Yes. So if there's active infested or active disease going on, we're looking at supportive care for the acutely ill patient, and then also referring to specialized, the people that treat such conditions are known as gastroenterologists. Okay, so if you meet your primary care physician or your family physician or whosoever physician, they would like to either refer you to the gastroenterologist that would continue the management or take over the management of such cases.
Apologies that your calls are coming in as beep calls. We can't take that. Please try and send a text message rather. If you cannot, call us 0806 804 5443. The weather is something else, but we understand. Doctor, let us talk about the management quickly. Someone that has this already and the person wants to survive and the person still wants to live, I could say healthy. what should the person know? What should the person do, even when the person has gone down with hepatitis, maybe B or C?
Your
In few minutes,
Your
doctor.
doctor will give you a plan, a detailed plan on what to do to stay alive or to,
Doctor, let's talk to this caller. Hello, good morning.
Yeah, good morning, my sister.
Thank you for joining us.
Yeah, doctor, good morning, sir.
Good morning to you.
Yeah, my name is Dinesh. I'm calling from you.
All right.
First of all, let me appreciate you in the studio today for the wonderful lessons. And then I have some questions to ask the doctor concerning hepatitis. Doctor, please, my one question is, which of the hepatitis the most dangerous, A, B, or C?
Most dangerous. Which of the hepatitis is most dangerous?
That's
Based on the chronicity, you would put the hepatitis B, C, and D, because those ones make about. Is my mic working?
Yeah.
Those ones, that come from the Epstein-Barr virus, the cytomegalovirus, those are the ones that you would fear most. Already told you, B, C have some chronicity. Good thing is C is curable. B, not yet, so curable. And then D occurs with hepatitis B superinfection.
Doctor, what of A? What of A?
That's from the fecal-oral route. And like I said, it's most times self-limiting, rate limiting.
Okay.
Yes. And
Yeah,
the
because
E
I
that
have
occurs in
a
pregnant
case,
women.
which we lost such a young man. We discovered that he had hepatitis A, and we try everything humanly possible in terms of respect.
Did you access care in the tertiary medical facility at the UTH?
So along the line, even
Did they take him to the UTH?
Of course, even if we moved to Enugu, there is no hospital that they recommended, but along the line, we lost the young man. But the hepatitis was hepatitis A, just A, that we discovered through.
Diagnosed.
Yes, through the diagnosis.
So sorry about your.
It could have been a
family
late
member that you
presentation.
lost.
It could have been a late presentation. There could also have been some other toxins, use of toxins before getting, hospital help.
Then, doctor, there's another question, sir. Apart from you, if, for example, you talked about you may have an hepatitis, then you don't notice that. Is it caused by food, or what can be used apart from you noticing that you have hepatitis? What can you use as prevention? Thank you.
Yeah,
Thank you so much. Thank you so much. Listen to the doctor, and he will, in 30 seconds, address that, because we've come to the end of Healthways already. That's why I gave out the numbers quite in time for you to call in. Thank you so much. And we're so sorry about the family member you lost to hepatitis.
In a nutshell, we win. This is where we win. Prevention. Okay, so the vaccinations, we have vaccinations. There are adult vaccinations as well, and we also have to practice safe sex. Condoms, help against vitamin B, C, and D. Also safe blood transfusions, safe food and safe water, safe medical procedures, screenings. These are some of the things we can do to, prevent hepatitis B from, hepatitis generally from occurring, especially the infectious ones from coming in. And then also from the non-infectious ones, you want to modify your lifestyle so as not to come down with hepatitis.
Doctor, we have to draw the curtain right here. So sorry that we have a lot to talk about, but we can't.